Okay, good morning. Apologies for the delay there. I'm convening and calling to order the House Early Childhood Finance and Policy Division. We're going to start by having the clerk take the roll.
Representative Pinto, Chair.
Present.
Representative Katiza-Watun, Vice Chair. Representative Franson. Representative Bonner.
Present.
Representative Damath.
Present.
Representative Heinzman. Representative Morrison.
Present.
Representative Pryor.
Present.
Representative Wozliak.
Present.
Representative West is excused.
Okay, so next, because we do have a quorum, we'll have approval of the minutes. So if I can have a motion to approve the minutes of our most recent meeting on March 19th.
So moved, Mr. Chair.
Thank you, Representative Bonner. And all those, so any discussion on that, any additions or corrections? And then all those in favor of approval of the March 19th minutes say aye.
Aye.
Any opposed? Okay, our minutes are approved. So the first bill up is mine, and so I guess I'll ask Representative Pryor if she can, since we are missing our vice chair right at the moment, to chair, to the testifiers table.
And I probably just covered up the script. Or do you have a script? Okay,
So,
great.
Madam Chair?
Thank you, Representative Pinto. Would you like to move your bill, House File 1230?
Yes, Madam Chair, thank you. So I will move House File 1230 to be referred, to be moved on to the General Register, and that I can explain that motion, Madam Chair.
And, okay. And, Mr. Chair, this is now the amended version of House File 1230, so move as amended.
Thank you so much, Madam Chair. That's correct. Yeah, thanks for that catch. So that motion is to move to pass House File 1230 to the General Register. And again, I can provide an explanation to members at this time, if that's appropriate.
Please proceed.
And so, members, you may remember, we've heard this bill a couple weeks ago, and at that point, it was laid over for possible inclusion in a division report. And at this time, I'm asking members to have the bill moved to the General Register. This is, you may remember from the discussion a couple weeks ago that these are provisions from the bill that shall not be named, Representative Heinzman. We won't use the nickname for it, but there was a bill that passed the House and the Senate last term. I should let Representative Heinzman make a comment. Looks like he wants to.
You have a comment or a question?
Thank you, Madam Chair. I think we've come up with a new name, so you can be prepared for that. It's on its way.
Oh, okay. Thank you, Madam Chair, Representative Heinzman. So whatever we're going to call it, there was a bill from last spring that passed the House and the Senate, vetoed by the governor, and it contained this language which makes some adjustments. You may remember to the scholarship program and voluntary pre-K. There's no fiscal cost. It is moving in the Senate, and the hope is that perhaps we'll be able to get some agreement between the bodies and move it forward. So we did have a discussion about it before, and so I would ask for member support.
Right.
And
Do you have any testifiers?
And I don't, nothing from a couple weeks ago, Madam Chair. Right. So it should be, yeah, folks should have what they need, but I guess we'll see.
Thank you, Representative.
Thank you.
And is there anyone from the public that would like to testify? Member questions? Seeing none, Representative Pinto, would you like to renew your motion?
Yes, Madam Chair. Thank you. And I do move that House File 1230 as amended be passed to the General Register.
All those in favor? Aye. All those opposed? Motion passes.
Thank you, Madam Chair. My next bill, Madam Chair, with your permission, is House File 2463. And I might ask, I believe there's someone from the Department of Education be able to come up and provide background. And Madam Chair, with your permission, I move House File 2463 before the committee for possible inclusion in a division report. And then I can explain the bill with your permission.
Please proceed.
Okay, thank you, Madam Chair. So House File 2463 is the Department of Education budget bill. We'll be provided with some additional information from folks from the department, kind of walking us through. I should note that an author's amendment was posted, and so we'll talk about that in a bit. But my suggestion, Madam Chair, is to walk through House File 2463 and receive information from the department about what's in it. They can describe it to members, and we can go from there with that piece.
Thank you. Please proceed.
Thank you.
Madam Chair, Caitlin Snyder, Minnesota Department of Education. This is the portions of the governor's education budget bill that relate to the subcommittee's jurisdiction. So Section 1 is clarifying language that says if a mixed delivery program is not receiving funds for a pupil, then the pupil may be charged a fee for being in the mixed delivery program. Section 2 is striking obsolete language. It's dividing the voluntary pre-K and school readiness plus program from 4 groups to 5 groups by separating the Minneapolis and St. Paul districts. There is language on 3.7 outlining that the participation limit for the 5 groups should not be redistributed if we're just maintaining the participation limit. And then Section 3 would strike obsolete language, and what this would do is maintain the participation limit that's currently established for the voluntary pre-K and school readiness plus program. This would maintain the 4,000 spots that are set to expire under current law. Section 4 would establish an early learning scholarship account special revenue fund. What this would do is transfer funds that are appropriated from the early learning scholarship fund to a special revenue fund. And the purpose of this recommendation is that current language for the early learning scholarship doesn't align very well with the general fund. So a general fund appropriation needs to expire within 24 months. Early learning scholarships, the regional administrators have 12 months to give a scholarship to a family. The family has 12 months to use the scholarship to find the right program for their family and their needs, and then 3 months to bill the department. That leads to 27 months when everything is working as best as it needs to, which leads to cancellations in the general fund. So by transferring the early learning scholarship appropriation to a special revenue fund, this will avoid cancellations that have happened in that program, and we estimate that this will lead to 1,000 more scholarships being given to families without an increase in the appropriation. Section 5 and Section 6, this is language that you've also seen in front of the committee from a Representative Herr bill last week. This would allow all Head Start programs to meet federal requirements for background studies that will go into effect this fall. And Madam Chair, I also have Bobby Burnham, Director of Early Learning Services, with me to answer questions as needed.
Madam Chair, that should be it in terms of describing the bill. I think we can see if there are folks who want to testify and answer questions. We can, as I mentioned, there's an author's amendment that was posted, and we can address that. I guess maybe, Madam Chair, if it's okay, I might suggest perhaps we have questions, et cetera, on the bill itself, and then I can raise the amendment as a topic as well.
Member questions on the bill itself? Representative Demuth.
Thank you, Madam Chair. Chair Pinto, does this bill include language to prohibit VPK from supplanting local funds?
Madam Chair, Representative Demuth, I don't know if the bill does. I think there is such language, I believe, in statute already, but I'll maybe look to folks who have expertise to assist me in that. I believe that's already in statute, but I could be wrong about that. Oh, Ms. Okay.
Ms. Demuth.
Madam Chair, committee members, Bobby Burnham, Director of Early Learning. There is language in the School Readiness Plus statute, and we ask superintendents to sign a set of assurances, and this is included in that set of assurances.
Thank you.
Representative.
Thank you.
Thank you. Other member questions? Representative Weslick.
Thank you, Madam Chair. I'm wondering if maybe one of the testifiers could just give us an idea of, I think we heard this figure before, but how much of the funds that go through the early learning scholarships are actually left over. Because I know one of the purposes of creating that special account is so that we can use that money that's not used by families. If someone could maybe talk a little bit about how much that is.
Ms. Burnham?
Sure, Madam Chair, committee members, I don't have those exact figures. We can certainly get those to you. What is happening with the nature of this model is because it's the scholarships, a child could be awarded, let's say in October, but actually not attend a program till maybe March. So that money actually is just sitting there. And so once the child attends the program, the invoices start coming in. And so it's a matter of working with our regional administrators around forecasting. And each year this program's been implemented, we've gotten better and better at that and worked very intentionally with our administrators to help them develop better forecasting tools. But this special revenue account would really solve that issue of the forecasting.
Madam Chair?
Yes,
Just to
Ms.
add
Snyder.
to Ms. Burnham's point, the cancellation figure that we've seen in the past has been $8.5 million.
Representative Wesley? Okay.
And Madam Chair,
Representative,
I forget if this was noted, but I think that this change will allow an additional 1,000 students, and maybe you had said that, but if not, an additional 1,000 students to be able to take advantage of, or 1,000 children take advantage of the program without increasing the allocation, simply by allowing for more flexibility in the funds. I'm seeing nods from the testifiers, so that's good. Good.
thank you.
And Madam Chair, maybe at this time I should bring up the amendment, or if
All
that's
right,
appropriate?
please speak to the amendment.
Yeah, thank you, Madam Chair. Members, there's an A1 amendment, and that was posted. I'm not going to offer it at this time. This bill, as with other bills, after that first bill, is being laid over for possible inclusion in a division report. Our division reports will hopefully be out fairly soon, and with each of the steps in the process here. And so part of the point with the A1 is to raise some ideas as the process is continuing. And so I guess I would maybe welcome that when there are public testifiers on the bill itself, if they have comments on the A1, to feel free to share, recognizing that if these ideas do show up in a division report, there of course is another opportunity for testimony, and then obviously amendments and all that process as well. So for folks understand that, and so further opportunities. But I will not be, I guess I'm not offering the A1 amendment to House File 2463 at this point. So thank you.
Thank you.
So to maybe public testimony, I'm not sure, Madam Chair,
Any public testimony on the A1 amendment?
or the bill, or the bill.
On the bill, sorry. Yes. Member questions? Representative Heinzman.
Madam Chair, I just quickly ask Representative Pinto, do you think that now would be a good time to hear from the agencies as to some of the major changes that would be taking place if the A1 was adopted? Or would you like that for a later time?
Madam Chair, Representative Heinzman, thank you. I think that would be, I don't know how prepared they are to provide that information, but if they have some preliminary thoughts, I would certainly welcome them to. But I would certainly want to make sure and would know that if the A1, if this language were to go forward, we of course would want to be hearing from them. So if agencies feel ready to provide any thoughts on that, they certainly can. But otherwise, we obviously want to make sure that there be that opportunity then.
Thank you for follow-up, Madam Chair. So, Representative Pinto, we discussed just a few minutes, I think you mentioned before you started, that there's language moving on the Senate side.
Oh, yeah.
Is there anything moving that resembles the A1?
And Madam Chair, Representative Heinzman, I'm not aware of anything moving, and of course we know that's true in a lot of areas, right? Whereas you've got stuff happening in the other body, stuff happening in this body. I should note that my reference in that first bill was just that the leaders had encouraged at the beginning of session, saying if there were provisions in that bill that we don't have a name for, that could move through the bodies, that's great. But no, regarding the A1, I'm not aware of anything on that at this time in the Senate.
And I believe that we do have a testifier to speak to the question.
Ms. Burnham's taking the bait, Madam Chair, and Representative Heinzman.
Ms. Burnham, if you could
Madam
state your name
Chair,
again
committee
for the
members,
record.
thank you. What I really wanted to do was just give you provide you some information with what's currently going on in this realm around how the cross agencies are working to explore exactly what it will take and what currently exists in the areas of universal identifier and this coordinated service delivery information system around data sharing. So with our preschool development grant, we did budget for a year's worth of exploration on seeing exactly what it would take, both fiscally and humanly, to put a system like this together, because we know and recognize that this is very much needed. And so we are in the process and have been working for months on developing and designing and mapping current systems and current data across the agencies. And so hopefully at the end of this preschool development grant, which is December of 2019, we will have a very good idea of what it will take to develop this system. So we are working with Minute, we are working with Department of Human Services and Department of Health, and so we are in the process of exploring what it will take to do this. I just wanted to inform committee members of that.
Representative Pinto.
Thank you, Madam Chair. And I think Ms. Burnham may be talking somewhat more about the coordination and universal identifier provisions that were in, actually, the chair's bill that we heard the other day. But I will say that I do view this as sort of being somewhat part of that same effort of saying we've got these programs that are in different areas. We had to have this committee to report to multiple this division report to multiple divisions, and to view this as being part of an effort for coordination as well. So, but, yeah.
Representative Heinzman.
Thank you, Madam Chair. So what I was actually kind of moving to discuss, I guess, if the agencies were interested, I was hoping maybe, you said, I think, Representative Pinto, that they might not be prepared to do so, but if they were, I would be curious why we're transferring a major education into the amendment, a major education program from MDE to DHS. The amendment is being discussed, but we're not moving it, so I'm not sure if there's anyone here that would like to shed some light on that and how maybe the Department of, well, DHS or MDE, if they had some feelings, it'd be nice to know that sooner than later, and I'm assuming that they do. And so if they don't want to discuss it, that's fine, but there's going to be a lot of questions relative to that transfer of authority.
And Madam Chair,
Representative Pinto.
Representative Heisman, those are great points and questions. So my thinking on it, just to provide this first step, is that you've got a program, I think for a number of us, viewing the scholarships have been at age 3 and 4 have really been a focus. And I think for many of us, as you know, a lot of the committee, our perspective has been thinking birth up as much as school down as in the past. And so the thought is that if we're thinking of this as a program that is connected with development in those younger years, then it does start looking more like a program and a lot of connections with other programs that we have that are aimed at those years. So that's a lot of the substantive policy reason. I think the reason the departments may not be, I wouldn't necessarily expect them to be ready to comment right now, is that I think that this language and ideas is as new to them as anybody else. I don't want to have them be put on the spot for that. But that's part of the thinking. And so, but I think you've raised excellent points and that deserve to be aired out. And so, again, if there are comments that folks want to make in terms of testimony, I would welcome that now and recognize that absolutely would need to happen before something like this would be moving out of this committee.
Representative Heinzman.
Thank you, Madam Chair. So Representative Pinto, my concern is I'm reading through the amendment, as I'm not seeing anything, you may be able to point to it, that would prohibit HHS Finance from moving that $70 million a year in scholarships to CCAP. And we've had lots of conversation about CCAP, and it's going to be a very significant ongoing conversation. And I'd love to be shown that isn't a possibility in the language. But as I'm reading it, I may be missing it. And if you have something there, that would be great. But I'm sure the public is zeroing in on that the same way I might be. So,
Representative Pinto.
Thank you, Madam Chair. And I can tell you, Representative Heinzman, so one thing that's been really important to me is that the decisions made here as they go up I'm protecting those decisions. You know, and that's very important to me. Now, I don't know that you're going to like every one of those decisions, right? But definitely, as legislation, as bills are moving out of our committee and they relate to early childhood, that is very important to me that the work of this committee be protected, and that is critical. And I'm going to fight really super hard for that. So I guess that'd be one reassurance I'd provide. I'll also say too, you've got programs that you know, are aimed in different ways, and that ideally we hear from providers that are being braided, that are working in ways, so absolutely, each of these has a place. But anyway, I think you may have something else to add.
Representative Heinzman.
Thank you, Madam Chair. So I guess what I'm trying to nail down is very specifically the intent of the author, if the amendment were to be brought forward, would be to make sure that the dollars in this program, the 70 million in scholarship funding, is not going to be transferred into any other program, that it can't be used for any other program, that it would stay in the context that it currently is. There may be lots of discussions about both of those two pieces going forward, but specifically, there's some really significant concerns relative to CCAP. So I'm just laying that out for the public and letting them kind of have the opportunity to look more closely at this as well.
Representative Pinto.
Thank you, Madam Chair, and Representative Heinzman, thank you for the question. And I should note, I mean, I think that CCAP has a very important role to play too, and we're going to get to that. But I can assure you that no funding that is going to scholarships, absolutely, the intent is not to have it move elsewhere. And in fact, I would fight that very, very hard. So yeah, absolutely. And thank you. Thank you, Madam Chair and Representative.
Thank you. Any other member questions? Seeing none, Representative, would you like to renew your motion?
Thank you, Madam Chair, and it's simply that you lay over House File 2463 for possible inclusion in a division report.
So moved.
Thank you, Madam Chair. And then,
You may remain at the testifier. We now have House File 2319.
thank
Would you like to move your bill?
I would, Madam Chair, House File 2319, I move that for possible inclusion in a division report. And there are actually, Madam Chair, two authors' amendments that I guess I'll, with your permission, I would also offer the A1 dash, one moment, please. Make sure. The A1-2 amendment in the first instance.
So we have the A1-2 amendment is moved. All those in favor? Aye? Aye. Opposed?
Thank you.
The motion carries,
Thank you, Madam Chair.
and the amendment is adopted.
Thank you. And I think if it's okay, what I'd like to do is I'm going to offer the I'll offer the A2. Maybe we can do is discuss the 2319 as amended with this first amendment, and then we'll address the A2, if that's okay.
Thank you. You may proceed.
Thank you, Madam Chair. So, members, House File 2319, and now as amended, is a number of proposals that relate to program integrity for the CCAP program, which is under the jurisdiction of this committee, and then other human services programs as well. Members are certainly aware of the context of this, and I should note that there was one report from our legislative auditor and then another one that's coming out in several weeks. These are proposals that I'll have the commissioner walk through and describe for the division, and then we'll kind of work our way through. But with that, Madam Chair, with your permission, I'll turn things over to my testifier.
Thank you. Please state your name for the record.
Thank you, Madam Chair and members. My name is Chuck Johnson. I serve as Deputy Commissioner at the Department of Human Services. Thank you for the opportunity to be here, and thank you to Representative Pinto for carrying House File 2319, which includes the provisions from the governor's budget and legislative proposals around integrity for the child care assistance program, as well as Representative Pinto mentioned, some program integrity areas outside of the jurisdiction of this committee. I'd like to start by just sharing a little bit of background. In 2011, the department created the Office of Inspector General. That was done internally by then Commissioner Jessen at the time, to bring together several regulatory functions within the agency and align those in one place. And that included licensing and background studies, as well as fraud. Licensing and background studies already existed as separate divisions, but our fraud work was sprinkled across the agency within different program divisions. And the key here was bringing that all together into one place so we could really dedicate an area that was focused on program integrity within the agency, that was separate from the program areas, and that provided a culture that was really focused on fighting waste, fraud, and abuse. It was also debated at the time kind of where this belonged and what it looked like and what we called it. An Office of Inspector General was the title that was agreed to internally. It was never an issue that was ever brought to the legislature for any confirmation or so forth, I think, as the legislative auditor pointed out. It's greatly expanded over time. I think the success of having all of these functions in one place is that we've really been able to focus our efforts and have a voice in the room in department decision-making that is really focused on program integrity. Our SERS area, which oversees program integrity for our Medicaid program, has way more than doubled in size since we created it because of the understanding of the need for resources in that area. And of course, in 2013, we brought to the legislature the creation of authority for the commissioner and resources to investigate child care assistance program fraud as well. That was adopted by the legislature in 2013. We appropriated money to begin creating that unit. The unit was essentially doubled in size in 2017 when we came back to the legislature and asked for more resources. This really arose out of our awareness, growing awareness in the early part of this decade of experiences in other states and experiences that are being brought to us by counties and others, seeing around child care providers and concerns about many of the businesses and how they were being run and whether the programs really were providing child care properly and getting paid properly for that service. So over that time, along with increasing the resources devoted to fraud, we've also brought forward, and many of you have brought forward, and many of these have passed the legislature, but not all of them, many proposals to try to address the program integrity within the child care assistance program, as well as the tools around how we do this work. That includes tightening controls on the number of children who have parents working at a center, record attendance keeping, provider compliance, penalties and disqualifications, investigative authority, and many more. Many of which we will talk about again today in 2319, because the constant evolution of working against fraud is to identify where the fraudsters are going and to try to be ahead of that as much as possible or not too far behind when that's where we are. And many of these provisions will really help to tighten up those areas. We recognize that there's a tremendous amount of work to do in this area. And as I said, we have been working on it. We've been working with you on it. But there's more work to do. Some of this is already underway. Some of this is work that we've been doing internally at the agency. Last year, we issued a request for information for proposals around electronic attendance record keeping. Attendance record keeping is a really important part of the child integrity in the child care program. It drives the billing, it drives where the dollars go, and it's a key to how some of the fraud schemes that we've seen have worked. We think it will provide a lot of integrity. We got some good information of that. That's a next step that we will also be talking about today as the governor is going to propose that we continue work toward an electronic attendance system. We also have a continuous improvement team working with our fraud investigators on their own internal business processes. This is the continuous improvement team that we allocated over to the Department of Health last year to help with the problems in the Office of Health Facility Complaints. It's a very highly skilled team that really works effectively at changing and improving business processes and using technology better in that process. A lot of what we're trying to do in that work is to ensure that we're using data as best we can and making decisions about how we're investigating fraud, how we are identifying fraud, how we're investigating it, what we're doing at different decision points, how we're making decisions around whether to take a case, how quickly to expedite a case, whether to move a case down a criminal route or an administrative route. And that's an important point, I think, in all of this, that we recognize and certainly have prosecuted or helped to prosecute a number of cases that represent criminal fraud in this area. And we know that there's more work to be done in that area as well. But we also need to use the administrative tools that we have to stop the flow of funds before that flow continues to go on. And I think we haven't been as effective in this area with using those administrative tools as we have, for example, in medical assistance, where we use these administrative tools all the time to disqualify providers, to shut down providers, to stop money, and to recover dollars when we can through administrative routes and through civil procedures. And so we want to work with our fraud investigators to figure out how we use that track better too, because criminal investigations take a long time, and sometimes they can be hard to prove. The legislative auditor talked about this in great detail, the difficulty of proving these kind of fraud cases and what's involved in terms of gathering the evidence. Administrative tools can often be used much more quickly, and if we identify a problem and we can stop the flow of money, that can help a lot in terms of the fiscal side of this, which as a former agency CFO, I care a lot about us being effective on as well. There are many changes in the bills we're going to talk about that actually help us with that administrative process and tighten it up. We have had problems with the administrative process, both in terms of how sometimes the administrative law judges will view the evidence being brought to them, sometimes in terms of the standard that we use, and I'll talk about that as well. And so I think that's an important point that we're trying to work with now on becoming more effective in how we're staunching the flow of dollars. We also need to work on building the competency of our own team to effectively work with the people we serve and to effectively work with all the communities that we are involved in. And that involves several steps that we've already undertaken. We're in the process of hiring an equity coordinator to work with the OIG. We have equity coordinators in other parts of the agency. That's something we've been adding over the last couple of years around the agency to help us work with all the communities that we serve, which are disproportionately not people who look like me. Training for staff on implicit bias is scheduled for later this spring for the staff in the OIG. We did some training last year as well. I think that's important for all of our staff, but these in particular are staff who are interacting with the public in a way that some of us bureaucrats who are in our offices in St. Paul aren't doing as much. And so I think it's critically important that those staff get this training as well. And then as Commissioner Laurie said last week, we are very interested in creating and will be creating a community advisory committee to help us as we go forward on this work and to continue to work with differing parties who have very different opinions about how our work is affecting them and trying to bring people to the table, because we need to be effective at addressing the waste, fraud, and abuse in the system. We need to do it in a way that partnerships with those who are interested in working with us and not creating divisions where we don't need to. In the bill that you have before you, House File 2319, this is a comprehensive package of the governor's proposals to address child care fraud. And it really follows many of the recommendations that were made by the legislative auditor in their report, as well as recommendations that we got from the contractor that we hired to help us examine our internal processes around child care assistance program, PFM. And it really is a good set of steps for us to be following. So with that, Madam Chair, I would like to walk through the sections of the bill first, and then I'll go to the amendment that was adopted that are relevant to child care assistance program. And there are, I believe, 13 sections in the bill that relate to CCAP, sections 1 through 11, and sections 17 and 21. Section 1 on page 1 of the bill clarifies the ability of our investigators to share information with law enforcement and with county fraud investigators. We believe that we have that authority now, and we certainly do share information and have in some cases, but it is a question that's been raised periodically because the law is fairly specific about sharing of information on open investigations. Our investigators are state employees, they're not sworn law officers, so sometimes that can affect what might be considered okay and not okay. But we do need to work with the partners in this. We need to work with county investigators who are often bringing us evidence or working on similar and related cases. We need to work with law enforcement where, for first of all, that same thing might be happening, but also, of course, when we approach the point where we are moving in a criminal direction, we need to have law enforcement involved in order to start building that case and move it toward a prosecution. Section 2, which is on page 2 of the bill, addresses liability for certain acts, and this is a federal compliance with the False Claims Act. The Federal False Claims Act provides higher penalties than are provided right now in the Minnesota False Claims Act. As a result, we're considered out of compliance for the purpose of particularly with our medical assistance program, but other collections as well. Within the False Claims Act, if you're in compliance with it, we can actually get a 10%, retain essentially 10% more of what we collect instead of having to return it to the federal government. So the impact here is that by being out of compliance, we are losing some collections that could be going to the state general fund or instead going back to the federal government. We have been out of compliance since January 1 of this year. This was a law that was changed, I believe, in 2015 by the feds. And we proposed alignment with this federal law in 2017 and 2018, but it didn't pass. And we got an extension from the Department of Justice through the end of calendar year 18, but now, as of January of this year, we're out of compliance and potentially could lose some collections as we go forward. So we'd like to see this passed. This would just automatically leave the state in alignment with the federal government, which has, I think, inflator increases in their penalties to allow us to continue to stay in compliance over time. Section 3 that's on page 3 of the bill, this is essentially a CCAP data transparency item. We found as we got into this business, we had many requests for information on how much we were paying to different child care centers, how much we were paying to different providers, how many kids they were serving, questions like that, which seem reasonable. Many of them are coming from members of this body, which seem reasonable that we should be able to provide that information. We're paying public money to a business to carry out a public task. But as it turns out, we actually can't share that information on the Data Practices Act the way that it's written now. So we would like to create a window for where we can share information. In particular, what this bill would do is allow us to share information on child care centers that are receiving $100,000 or more in payments through the CCAP program to identify those centers as how much they're receiving. And then secondly, to identify or share information on any center that has had some kind of a negative legal action taken against it, a disqualification or criminal action, those kinds of actions. And we think that transparency is reasonable within this program and necessary given the public conversations appropriately around this topic. The next section is section 4, it's on page 4 of the bill. This deals with retroactive eligibility for the child care assistance program. Under current law, retroactive eligibility can extend for 6 months. That's a pretty long period of time. In medical assistance, it's only a 3-month retro, for example. And so having our programs aligned and having a reasonable period for retroactive eligibility makes a lot of sense to us. But also we've seen that it can become very difficult when you have this longer period of retroactive eligibility to actually figure out how much child care assistance is really used or not used. And that window can become a period of time in which someone just trying to falsely bill us can use that retroactive in order to create false billings or get paid for care that didn't actually happen. We think 3 months is a reasonable period of time. We do need to have some period of time for retro eligibility because the eligibility process at the front end can be pretty complicated, particularly for families who are on MFIP, who need to meet with a job counselor, need to get together a plan for work or going to school. And those steps often take time. At the same time, they're working with a CCAP eligibility worker to actually lay out an authorization schedule for how many hours of childcare they're going to need. So we think 3 months is a reasonable time period and will mitigate the potential for using that more lengthy 6-month period as a way to create false billings. Sections 5, 6, and 7 all deal with attendance record-keeping requirements and how we do that. And as I mentioned earlier, it's a really important part of how we look at integrity within the program. Ensuring that we are getting accurate attendance records, that billings are based on accurate attendance when kids were really there receiving care is really important within this program. So Section 5 deals with enhancing the record-keeping requirements to say that attendance records must be made available immediately upon request. So if one of our licensors or one of our fraud investigators shows up at a center and says, I'd like to see your attendance records, those have to be produced immediately. This is a loophole, and a couple of these others are as well, that we've seen exploited at various times, where we've moved through to an administrative hearing to try to disqualify a provider for not providing us with attendance records, not having attendance records to support their billing, and then at the last minute in the hearing, the provider brings in the attendance records. And certainly from our perspective, that seemed like those are probably false attendance records, but that wasn't the way it was looked at in the judicial setting. So we would say, obviously, if this is an important thing, it should be done on a daily basis, it should be done in real time, and it should be available when we ask for it. So this would change the law to make clear that it should be available immediately. Also in Section 5 on line 6.4 is another provision that does something a little bit different that is also important to how we manage our fraud investigations within the Child Care Assistance Program. And this is how overpayments are calculated. Calculation of overpayments now is not consistent across how different payments are made and is extremely difficult to do and requires counties to go through a lot of records to reconstruct exactly what was paid and for what time period was paid and so forth. So first of all, it's a pretty big burden on counties, and they sometimes are reluctant to do it because of the amount of time that's spent on it. But secondly, it results in potential for inconsistencies in how, when we're bringing forward an overpayment, in an administrative setting, in a criminal setting, questioning how it was calculated. Having a consistent method for calculating the overpayment will allow us to say this is what the law says we're supposed to do and how we're supposed to calculate it, so that we can actually then use that as a defense as we're moving forward in those cases. Section 6, as I said, also relates to attendance record keeping. And this is a failure to report a decrease in attendance. A few years ago, we put a provision in place that said the providers must report to us when there is a decrease in attendance. Again, this is something we've seen happen where we're getting billed, say, for a full day. We find out after the fact that the child for the last 6 weeks had only been attending for part of a day, and it hadn't been reported to us timely. What we don't have now, though, and what this will add is a penalty actually for that. So when we identify that a provider has not actually properly reported a reduction in attendance, there would actually be a penalty that would go with that to enforce the correct rules around how we want attendance to be tracked. And then Section 7, again, on the same topic, this is how absent days and holidays are billed. The law does currently allow 25 absent days for a child in a given year. And that's to accommodate the normal things that happen with families in terms of being absent from care at different times because the child is ill or because the child is, because the family is on vacation or whatever. And generally, any of you have paid for child care know you're paying for a slot and you're paying whether your child is there or not. It doesn't work in the way that you just get to pay for the hours you want, or not very often does it work that way. And so this would be clear that when there's an absent day, it has to be billed to us as an absent day in the initial billing. Again, we see this happening where we get a billing that shows the child is being paid for that day. We come back later and say, this child wasn't in care that day, why did you bill us? And they say, oh, well, that was an absent day. It needs to be billed to us as an absent day. You know at the time it's an absent day, that's how it should be billed to us. And this would allow us, again, obviously, along with those other provisions I just mentioned, just more integrity around how that process works. Section 8 is a provision that allows us to look across our programs when we have a provider or in sets of individuals who are owners of a particular set of services and disqualify across those programs. So if we identify, for example, that we have a provider who's been disqualified for childcare and improper billing in the childcare program, they may also be running a personal care attendant program, which we also pay for through the MA program. We want to be able to disqualify them across those programs and ensure that there's not fraudulent programs running in different ways. We do this now at the point that a new provider comes in and applies. If they come in and apply and we say, oh, wait, we see here that you were disqualified, for your PCA program, so we're not going to let you open a child care program. But we don't do it in real-time, ongoing fashion, and that's where this law would strengthen our ability to be able to identify where those are happening and ensure that if we have bad actors, that they're not running multiple programs under our jurisdiction. Section 9 provides some administrative sanctions for kickbacks. I'll come back to that when I talk about the kickback provision, which is at the end of the bill. Sections 10 and 11 deal with the issues around administrative disqualifications and how those are done. And there's a couple of different pieces that are in this bill, or in this section. One is that it changed the disqualification periods. Right now, disqualification periods for child care providers are 1 year for the first offense, 2 years for the second offense, and then it's permanent upon the third offense. This would change the alignment of disqualification periods to be 3 years for the first offense and then permanently for the second offense. So it would step up our enforcement and discipline around administrative disqualifications. And I should say, with all these things, there's clearly appeal rights that are involved in this, and it follows a normal process of allowing people to due process in the event that they disagree with a decision that's been made either by us or by a judicial body. And then secondly, this changes the standard of evidence for child care assistance administrative disqualification hearings. Right now, that standard of evidence is set at clear and convincing. Clear and convincing is a higher standard than what's normally used in administrative and civil areas, which is preponderance of evidence. We use preponderance of evidence within our medical assistance program. So again, we're trying to be consistent in how we handle these kinds of decisions, and in this case, the standard across our programs. Preponderance of evidence is essentially about the 51%. It's more likely than not, this is what happened. And we have definitely had some challenges with that higher standard of clear and convincing in some of the actions we try to take on providers, and we think that this would be a fairer standard to use relative to the protection of public dollars. So then, Madam Chair, we skip ahead to section 17, which is on page 16 of House File 2319. This is immunity for good faith reporters. And what this provision allows is that when someone reports to us in good faith that they suspect there is a provider or a program that is fraudulent or misusing public funds, that we can give them immunity from civil action later. This is something that we have in place now in statute for reporters on vulnerable adult abuse as well as reporters on child abuse. We think it would help a lot in terms of getting people to come forward to share information. Right now, a lot of people will call and ask, well, can I stay anonymous if I share this information with you? And the answer has to be no. We can't necessarily guarantee them that, depending on where the investigation goes. And we have had reporters who have faced civil action for having reported in what we believe was in good faith. And so it does create risks for the reporters, and it does tend to tamp down the number of people who would report where they suspect there may be fraud, waste, or abuse within the program. And then finally, Section 21 in the bill is the anti-kickback law and penalties established for kickbacks. We don't have right now anything in state statute that criminalizes the use of kickbacks within our public programs. And this is mostly, again, both a child care assistance and a medical assistance area. And we've certainly seen kickbacks as part of a lot of the schemes in both those areas for how fraud can be perpetrated. This applies to both the providers and the recipients, so it's both paying a kickback, it's also receiving a kickback would be treated as a criminal act. And there are penalties that are built into this. And there was some discussion in judiciary yesterday around the penalties and how to look at that, and that is something that we'll work with the author on identifying some improvements we may be able to make in this part of the statute. This is modeled after the federal anti-kickback law. And so it, we think will align us pretty well to be in alignment with the federal law and to have a set of tools we can use in addition to the tools we already have, because when you're prosecuting fraud, The more different ways you have to come at it, the more different ways you have to find a hook in order to be able to create a case, the more likely you are to be successful in doing that. Madam Chair, I think I could speak to the amendment now. There are, the first, I believe it's 24 pages of the amendment and the first, I think it's about 18 sections of the amendment are related to ownership provisions. This is an issue that's been brought up. It was brought up by the legislative auditor. It's brought up by our own consultant, PFM. It's also been brought up by investigators on many instances. The difficulty of figuring out who's owning and controlling programs, particularly obviously fraudulent programs, can be a real challenge in terms of figuring out how we get not just to being able to take action against them, but how we prevent and ensure that those same individuals aren't showing up behind some other program next month or next year. And this will help us a lot in moving in that regard. This addresses several issues related to ownership, the structures that will enhance program integrity, and also streamline the sale of programs when a new owner intends to assume operating the program. This was a change that we did propose in 2017. I think it was in the policy bill that got stuck somewhere through the 2017 and 18 session. So we've made a few tweaks to it, but there was quite a bit of engagement with stakeholders around the time that we brought forward these ownership provisions. In 2017, there were a couple of hearings in the Senate, so it's had some vetting already within the broader community around this. What this will allow us to do is more accurately identify who should be held responsible for the actions that are associated with specific licensed programs or services. And that can be challenging sometimes. And to ensure that those holders are notifying the department when there are changes going on so that we can understand who is currently in charge of different parts of the program. So a couple of specific things that this language does. It adds a new notification requirement that a license holder has to notify the commissioner before making changes to the business, including change in controlling individuals, change in authorized agent, information on file with Secretary of State, changes in location or program services. These are things that we sometimes get notice on, but don't always get notice on, and it can be very complicated to keep on top of. And again, significant change in individuals need to be added to a licensing database and clear a background study. And that's what this allows us to do, is to have better understanding of who's actually behind a business. Requires the business that's applying for a license to supply all the documents that are created as part of that. Describe the relationships among the individuals who are involved. This is more information than we generally get now, so it'll be very helpful for us in this regard. And this will help us better identify who really owns the programs. This would also allow us to limit communication during the application process to the controlling individuals or agents who we've actually done a background study on. Sometimes there are intermediaries who get involved in some of these conversations, and that's fine. There may be a need for some additional help, but we want to make sure we're also interacting directly with the people who are actually going to be running this program, and that they aren't hidden behind a screen. And also allows us to issue a temporary immediate suspension of a license when a license holder is criminally charged in state or federal courts, similar to what I just talked about before, for an offense that involves fraud or theft against a program administered by a commissioner, ensuring that consistency. We think that this will help protect. This is a really difficult area. It's really difficult to always know exactly who's behind a particular program. We have to know what we're told, but having better information and stronger requirements around what we're asked, what information we're asking for, what information has to be provided, can help us to do a lot of strengthening in this ownership area. We think it'll result also in fewer service interruptions, which can happen now when ownership changes happen. And then, Madam Chair, at the end of the bill are riders, I believe, or I'm sorry, the amendment, I believe on page 31 of the amendment, that relate to the appropriations for the items that are in the governor's budget, as well as the governor's supplemental budget that will be released tomorrow, related to the Child Care Assistance Program integrity initiatives. And so I'll just walk through those so that you're familiar with what those items are. The first item on line 31.1, this would provide us with additional staffing for a licensing division. 5 licensors, a supervisor, support staff, and a data analyst. The role of these individuals that we'd like to add to licensing is really to help support and expand the work that we do around enhanced monitoring of certain providers. We set up this enhanced monitoring unit when we created the fraud investigation unit in 2013. There are 2 people that have been doing that work. This would expand that to 5 plus the support people. What they do is they work with providers that seem to be having some kind of trouble. This can be a conditional license. It can be an identification of potential fraud going on where our investigators have identified maybe we need to do some extra visits to this particular provider and see what's going on. We would also target this work toward newer centers and making sure we're doing quarterly visits over the first year with new centers. New centers struggle sometimes, not necessarily because they're fraudulent, not necessarily because they're doing anything wrong, but because it's hard to bring up a new center. It's hard to bring up the business aspects that are involved in it. And avoiding the thing where we come in a year after they've been operating and drop a conditional license on them, find a bunch of problems, to try to be more active along the way in ensuring we're preventing those problems. Obviously, part of that can also help in terms of identifying earlier in the process, is this a place that looks like they're really running a child care program? Or is there potentially something that we need to have our fraud investigators look into more closely? One of the things our fraud investigators have told us is it's really challenging when new programs open up because a certain period of time usually passes before we're getting some kind of a tip or something else to react to that's telling us, hey, this is a center we may want to look into. And of course, during that passage of time, more money is going out the door that might be being fraudulently paid. So this will help us a lot, I think, in terms of working on that particular issue. We're also asking for 2 data analysts on line 31.7 to work directly with our child care fraud investigation unit on their data analysis I mentioned earlier. That's a big piece of how we want to use data to drive our investigations and ensure that we're making strong decisions based on what the data is telling us about how to target those investigations. We're also adding 4 investigators to this is on line 31.11. This is actually related to Medicaid at CSRS investigators. On line 31.5, this is dollars that were in the governor's original budget for a case management system for our child care fraud investigation unit. We right now don't have a tracking system that we use for managing our investigations, for managing all the data that flows through those investigations. Again, going back to the data analysts that I mentioned earlier, having the case management system will help us in terms of having a consistent way data is being gathered and organized so we can do a better job of using that data for decision making. Line 31.19, this is funding for the fraud prevention intervention, which is a county grant program to support counties in their fraud investigation work, part of the governor's original budget. We are also asking on line 31.24 for a full-time staff to work on really a couple of different issues that we think we need to bring back to the legislature when we've had more time to work with stakeholders on them and more time to sort of develop what we think we ought to do on it. One of the recommendations from PFM, and it was something that was also referenced in the OLA report and that I mentioned earlier, is an electronic attendance system. Some states have adopted these. We think that it is be a really helpful tool in terms of creating consistency in how we're receiving attendance information from providers, how we're using that then for the purposes of tracking to billing. And so this individual, the FDE that we're hiring here, part of what they'd be working on is helping us develop so we could bring back to the legislature, what do we think this would look like, what do we think it's going to cost, what do we think the rollout's going to look like, as well as working with counties and providers and communities and others around what their interests and concerns may be around bringing in an attendance system, because some of these do involve biometric kind of information. It's a very sensitive place to go into, and we haven't made a decision on doing that or not doing it. I'm just saying that there needs to be conversation around that, those kinds of issues. Secondly, our vendor, PFM, who did the contracted work around the child care assistance program for us, recommended that we centralize the registration of CCAP providers and the enrollment of MEC-squared billers. MEC-squared is our billing system. Those are functions right now that are carried out by the 87 counties. And what the recommendation PFM made was that by having them centralized, we'd have better control and insight over to what happened with them. There'd be more consistency in how the decisions are made about registration. It would be a better tie-in to our licensing as well as our fraud work in order to understand if we're seeing people registering for CCAP who might have issues with on the licensing side. And so that's, I think, be a bigger lift for us, but we want to spend some time looking at that as well. Again, going to have to work with counties pretty closely on this. It's a county function now, probably requires some IT support. We'll need to bring that back to the legislature, I think, with some stronger recommendations around what direction we want to go, what's involved in doing that, the cost of doing it, and so forth. And so that's the other piece that is in here as well. And then finally, the governor is recommending in a supplemental budget, adding 2 BCA agents to the child care assistance fraud unit. We currently have 2 BCA agents who work with us under contract on these investigations. This would add 2 more.
Madam Chair.
Thank you, Commissioner Johnson, for your testimony. And we are impressed with the amount of information that you're giving us right now and the breadth of initiatives that you're suggesting as addressing the problems that we've seen. So I would like to now turn back to the bill's author, Representative Pinto, for your comments.
Well, I just, so Madam Chair, I want to make sure, I know we, there may be folks who want to provide public testimony who are here this morning. I want to make sure that we have the opportunity for that. I will just note there's an A2 author's amendment that was offered, that was posted after the deadline, and although I want to note that as chair I have the authority to waive that, what I'm inclined to do is to still respect that. Just to note for folks that this A2 amendment contains a number of proposals that I think could be really quite potentially really good additions to the bill, to 2319, and so certainly would encourage testifiers to provide any comment on that as well that they wish. But I am, as I say, I'm aware of testimony, and so thinking that may be something we would want to get to.
So at this point, we will turn to the A2 amendment. And just, this is for just to be introductory information, not to be considered as an amendment for a motion to adopt, but that there are testifiers here today that did want to speak to this amendment and
Madam Chair, I actually meant on the bill or the amendment, because if somebody
on the
came
bill
here, yeah.
or the
Because we want to
amendment.
make sure if folks are here, came this morning, that they get the chance to provide thoughts. And then, of course, we'll be having a discussion on other bills, et cetera, when we reconvene after session.
Yes. All right. And so at this point, we would like to invite members of the public that would like to make comments on either the bill itself as amended, and in addition to that, the A2 amendment that is being considered just for informational purposes this morning. And knowing that we do not have unlimited time this morning, but we will have further time this evening to take members' questions on it, we'll turn to public testimony now. And we'll have to keep public testimony to say 2 minutes at this point, and we will have time for questions, I think, after the public testimony, and then, of course, we do have a continuation where we'll recess tonight.
Madam Chair, just a question quickly, please.
Representative Heinzman.
Thank you, Madam Chair. Will the commissioner be here tonight?
Good. We should,
For
Madam Chair, we
questions.
should certainly confirm that. I would certainly, that's my
Thank you,
understanding. He certainly should be, because obviously it's important to be able to have member questions. Commissioner, do you mind? I guess with
Yes,
your permission,
so
Madam-
public testimony, please.
Okay, but. We're just confirming Commissioner Johnson will be here.
Oh, and Commissioner Johnson, would you be able to confirm that you will be here this, when we re-adjourn?
Yes.
That's.
Thank you, Commissioner Johnson. He will be available for
that's-
questioning.
Yeah, he needs to.
All right. So, yes. And if you would
Hello.
state your name for the record, please.
Yes, my name is Nasro. That's Nasro. Last name is Abshir, Abshir. Chair and members of the committee, my name is Nasro Abshir, and I'm here to testify in support of the amendment, House File 2319A2. So I'm the owner and director of a child care center in Minneapolis called Family First. I have 22 employees, and together we serve over 100 kids. I'm also a core leader with Isaiah and the Kids Count on Us initiative. As a provider, program integrity is important to me, and I want to make sure that families and providers have the resources they need to educate our kids. We cannot look at poorly run centers through the lens of criminality because it takes money and resources to be high quality. Centers that are struggling need to be supported and not demonized. The only ideas and proposals I have read for program integrity are for after the fact, how to make it easier to prosecute people instead of stopping it in the first place. So one of the ways people take advantage is by billing over their capacity. If you're licensed for 50 kids, with the current billing system, there's nothing stopping someone from billing for 60 or 70 kids. When they're only authorized for 50. Our current system is used to bill for $250 million, yet it's outdated and archaic. This amendment, which is on page 1.2, the childcare capacity and attendance, this amendment would track capacity, so you wouldn't be able to submit if you're billing over your capacity. This would single-handedly stop this form of abuse. Another amendment, which I'm not sure exactly where it is in here, but it's about hiring CCAP coaches. As a provider, even somebody like me who has a background in education, there's nobody there to tell you how to bill or like all the administrative things that come with running a child care center. So hiring a CCAP coach, which would help with unintentional overbilling, which happens when a center has done this more than once. So a CCAP coach would essentially help a center that has been proven to overbill, I guess, more than once. So they would come in and say, hey, what are the issues? Why has this happened? And help support them. And if it does look like it's intentional, that would also become clear at that point. So please support the integrity of this program by supporting this amendment, and thank you.
Thank you. Other testifiers, please. Please state your name for the record and spell it for good measure.
Spell it, okay. Good morning. My name is Mary Solheim. Last name is spelled Solheim. And thank you for hearing this testimony. I am here in support of the HF 2319 and testifying for the working group. I'm not sure where that is on that.
It's in the A2.
Okay, in the A2 amendment, okay. I'm also a provider and a child care director in Maplewood for Play School Childcare. I've been in education for over 25 years and in the child care industry for over 10. So I've seen both sides of the environment of being able to access support and being able to have a direction. For education, I did find that, and in childcare, it was a struggle. And I was surprised at what a struggle it was. And when I'm looking at a bill such as this and the support that it could offer in the directions that we need to go in the benefit of our own children, having a working group that includes providers that are at the base level of the everyday operations that it takes is so important. We have a reputation of taking in kids that have disabilities. We're very good at what we do, but we also lack that direction of what is necessary to help support that and to support the changes that are happening. I'm asking really that we have a working group that includes that wisdom from many people that have been in this industry over time, and to make sure that what we put together will be something that can affect change. And affect change in a positive way, not in a way that we're looking at child care providers as criminals. We're going to end up with no people to care for our children. And the fear that that has been established here is not necessary. There are so many people that are in this industry that are here for the right reasons, and that does need to be heard, and it does need to be felt. There is a saying in a disability justice organizing that goes, nothing about us without us is for us. And I want that to resonate with people here today, is that we do need people that understand the direction that childcare is heading. And that is by really implementing the wisdom that we have in this state. It's amazing. We have amazing people that do amazing work. And utilizing that wisdom is so important. And I want to just thank you for listening to this, and I appreciate just having the opportunity to say what we need to do. Thank you.
Thank you for your testimony.
You too.
Other public testimony? And members, I just want to take a moment here and remind you that there are a number of bills that we have not heard yet this morning and will not get to, but when we reconvene, we will have them. So just put them back in your folder, and then the pages will return them. Okay.
Madam Chair, if there are no other public testifiers, then I would think we move to
All
questions.
right, well, then we'll go to our list for member questions. And Representative Heinzman, you were first.
Thank you, Madam
Back up,
Chair.
I suspect.
Is it possible the commissioner could please return to the podium?
Representative Heinzman.
Thank you, Madam Chair. So I'm thankful I have this opportunity. I'm glad you're here, Commissioner Johnson. We have a lot of stuff we've been wanting to talk about. I think we've met, 19th meeting, and we finally have an opportunity to discuss some of the questions that we've been told we are not going to be able to get some information from, for example, managers. So I'm glad that the public can see a little bit more of what's happening inside the programs. You brought up a lot of information, and much of what you said, I think is in the right direction, and I appreciated the fact that we're taking this issue of fraud very seriously. But I do have some questions. You had mentioned in your testimony that there was a consulting group that helped develop the strategy for the governor's office and for this bill. And I was hoping that you could maybe identify that. You may have, and I might have missed it. But then if that were the case, I was wondering how much of the OLA's recommendations found its way into this bill as well. One of the serious questions I think that we see in the OLA's report is relevant to the difficulty that investigators found actually proving intent. Intent is always incredibly difficult, and I'm glad we have a prosecutor actually sitting there with you, Commissioner, that probably has gone through some of those same difficulties and understands the law relative to proving intent. I would probably be remiss if I didn't refer directly back to the OLA report. And I would direct folks, if they're following along, if they have the report, to section B, it's -11. And one of the findings or the discussion pieces there is state statutes, and I'm just reading directly from the second paragraph. State statutes are somewhat unclear on what the burden of proof is for child care provider fraud. If you could just describe to the committee, Mr. Commissioner, if we have in the bill, as you were describing it, dealt with the issue of intent, or if there's a section there that I might not have understood, and you may have mentioned it and I might have missed it.
Commissioner Johnson.
Madam Chair and Representative Heinzman, the sentence I think that you're referring to says unclear as the burden of proof is for child care fraud disqualification purposes. So the disqualification is the administrative procedure or civil action. As I understand it, the intent relates to the proving a criminal case. So it's two different tracks, essentially, to be taking a case. We are addressing the standard of proof for the disqualifications, which is what is being referenced here on page B11, by changing that to a preponderance of evidence from the current standard, which is clear and convincing.
Representative Heinzman.
Thank you, Madam Chair. I'm going to need you to be a little bit more clear so I understand exactly if this issue has been dealt with or not in the bill. Have we, in the legislation being offered today, worked to go towards lessening the difficulty trying to prove intent?
And actually,
Representative
if
Pinto.
I'm just going to step in just to say that Representative Heinzman, the paragraph you're looking at on page B11, which references clear and convincing evidence, et cetera, that is, and the Commissioner can confirm, that is, yes, addressed in the bill. It changes from clear and convincing to preponderance of the evidence. And we can point out the particular page on the bill to make sure that you've got that. And I should let the Commissioner confirm that, because of course he's the actual expert, but I couldn't resist stepping in. So that reference on page B11 is addressed in the bill. And we can maybe find you the page.
And we'll pause a moment and let Commissioner Johnson find the
Madam
reference
Chair
to
and
it.
Representative Heinzman, it's in the bill on line 11.6.
Thank you, Commissioner. I think we also had a number of other questions. Representative Wasilek.
Thank you, Madam Chair. Let me see if I can find it here. I just turned my page. So in the bill, on page 16, line 16.15, this is about the immunity for good faith reporters. And I'm just wondering if there's any language in statute that talks about what a good faith report means. Because I'm kind of unclear about what that means, so I'm wondering if there could be some clarification around that.
Commissioner Johnson.
Madam Chair, I'm sorry, I was having trouble hearing the question over here.
On page 16, line 16.15, the section about immunity and good faith reporters, is there any language in statute that talks about what a good faith report is? That's new language for me, so I'm wondering if you could maybe clarify that.
Madam Chair and Representative, that's a good question. I'm going to have to check and see if I have someone over here who can help me answer that. I'm not positive if there is another definition or if it's more something that would be determined through a judicial process, and then may have to get back to you on the answer to that.
Okay. Thank you, Representative Wasilek. Representative Morrison.
Thank you, Madam Chair. Thank you, Commissioner, for testifying today and for this very comprehensive approach to managing this issue. I have a question about the enhanced monitoring of certain providers. That phrase kind of makes me uncomfortable. So I'm just wondering if you could say just a little bit more about that. I just want to make sure that there aren't people being unfairly targeted.
Commissioner Johnson.
Madam Chair and Representative, that is a fair point. I think it's not the greatest term that we use. And that was what it was called when we created it back in 2013. Maybe we need to revisit the idea there. This relates, I think, somewhat to some of the reports that we've heard that there are concerns about child care providers who may be struggling but may not actually be fraudulent versus those that may be struggling or look like they're struggling, but it may actually be fraud. And our fraud investigators generally, and this is one of the things we're trying to improve by better use of data, but generally respond to getting a tip or getting information from another investigator or something like that. That can sometimes be late enough in the process, maybe if there is a fraudulent center, so you're not actually getting out and understanding what's really going on there, and a bunch of money may have gone out the door. The flip side of that is that tip may or may not be accurate, but if we're only doing our licensing, and we are in the process now of getting toward the one annual licensing inspections, but prior to that, the law had been every 2 years. It's a long period of time that can go on before there's anybody in there sort of putting eyes on what's going on. And so the idea here is to look at those centers, as I said, as kind of two areas. So one is where there might be some identified problem. They already have a conditional license, meaning they've done something that has put their license on a conditional standard, and we're supposed to be, they're supposed to be correcting that condition, and we're supposed to be ensuring that they're doing that. So having additional eyes in those circumstances helps. And can identify how we might be able to help that provider to be able to address whatever those issues are. Because we do want to support the industry. We need childcare. It's really important to a lot of families. And so that is an important aspect of it too. Secondly, we might have some information through the fraud investigator or through the county that they have a concern about this particular provider and what's going on. And just going in and again seeing what's going on rather than just jumping right into doing a fraud investigation helps us get a little better feel, maybe an opportunity for technical assistance rather than actually saying, oh, we're to do fraud. And then the other piece really is with new centers. And this is just because we see new centers struggling so often that when we come in for that first visit a year or a little bit later than that, we're seeing that they have had trouble getting the business set up and working in the way they wanted to. Having the quarterly visits that we're proposing with these 5 FTEs would allow us just to have better eyes on those. And as I said, it has a dual purpose, like a lot of this does, and I think that's where the enhanced or the targeting issue probably comes into it, is that our fraud investigators will also tell us the hardest thing is when a new one starts up and we don't know about it until they've already been running for a year and somebody gives us a tip, and we don't have any eyes that are necessarily on that place to identify, hey, let's get in here quicker so we don't have a full year's worth of money going out the door before we're actually trying to build some kind of a case.
Thank you.
Thank you, Representative Morrison. We do have another member of the public that would like to testify this morning, and so we will take, we can have another 2 minutes of public testimony. If you want to, please come forward.
Right here.
And if you would state your name for the record and also spell it.
My name is Mahat Omar, Mahad Omar.
Thank you.
I would like to testify against what is being proposed. For the past 1 year, a year ago here, a certain community was vilified. The report that triggered this things that right now that we're looking at assumed that as $100 million was going to terrorism, that $100 million of childcare fraud, there's a childcare fraud of $100 million. And it was some people in this body that has put it as that negative information. And the OLA was targeting certain community because the assumption was that if you're from certain country, you must be terrorist, you must be defrauding the government, that money must be going to terrorism. And I do not want to mention some of the members that are sitting here. This language was repeated. It was very dangerous. It was pushed again and again. We were waiting for the report. The report came out. It said there was no $100 million. It said that money was not going to terrorism. And instead of getting an apology, we are getting a new bills. We are getting targeted. And I do appreciate one of the members asking, what do you mean by certain? And after looking into the report, now that nothing can be proven beside the $6 million, we did say that if someone is committing fraud, we do oppose fraud, go after people that are committing fraud. But the reality is that there are 2,000 people on the wait list. And instead of funding, we're pitting the poor against one another, saying that your money was going to terrorism. That's why we don't have enough money. Let's go get that money back and give it to you. The reality is that some of the bills that are being proposed are specifically targeting mothers that have a lot of children. Some of the language that has been coming out of DHS, of the centers that were being targeted, one thing we need to do is look into it. Minnesota happens to have one of the worst racial disparities in the nation when it comes to education, when it comes to so many different things. And right now, one thing we're doing is we're introducing new bills to target people that are not making a lot of money, people that are on CCAP. So one thing we should be looking into is we are expecting an apology before we move on, and we're expecting from DHS and members of this body to look into the community that was investigated for 1 year and vilified and say how the reporting was, how they were targeted. The last thing I do want to mention is that there is this assumption and there is this narrative that is being pushed. There's a lot of racism going on. We've talked to so many people from DHS that it became norm to come to certain centers and vilify them and say horrible things to them. So I think before we move on, we need to go back and look at what was done. Also, another thing that I want to mention, it says here that on the bill, it is showing that, and this is the last thing I want to mention.
Thank you,
It says
Mr.
100 centers that are making less than $100,000. We need to be fair. If we're going to be passing bills, it should be fraud is fraud. If it is $10 or if it is $1 million, we should all look into everything. Thank you very much.
Thank you, Mr. Omar. Thank you for your testimony.
Madam
We
Chair.
are right now at the end of our normally scheduled committee time, but I believe Representative Pinto, you can have the final word for this morning, and then we will recess.
It was really just a process point, Madam Chair, that we'll be recessing and then return to the call of the chair, I would think, pretty shortly after session ends. We don't know how long that'll be, of course, so folks should be keeping an eye out. I believe we're scheduled to be in the basement hearing room. We'll keep an eye out on that as well, and I know there'll be a robust discussion following up on all these points at that point. And I do know Commissioner Johnson's going to be back. I've confirmed that, Representative Heinzman and members as well. Thank you. And so with that, Madam Chair, I'd suggest that you put us in recess, and we'll to the call of the chair.
With that, we are in recess.